The Prestera Center is one of many partners in the Safe at Home program. Its unique approach affects not only families, but the people who help them. Here's what some of our partners had to say about their work.
What we usually try to do is focus on the family strengths. You know, there are a lot of needs, but we also look at what the family does well and incorporate that into any plan.
We think outside of the box. It's not your typical services. If a child has, aggression issues and they have a history of that, what we can do is we can look into like boxing, or something like that, karate, different types of services.
So it's just instilling hope. There is a lot of hope in this program. Getting to watch a kid figure out that he's going to get there, he's going to get to go home, and that it's not always going to be about staying in a residential facility was very, very nice to see.
If I'm at a loss with what to do with a child, it could be because the family can identify certain things that they might need. We brainstorm everything.
I do believe that no child wants to have poor relationships with everyone. They don't want to be in trouble at school all the time. It may take a while to figure out what motivates that child or what exactly works with that child, but I think we'll get there eventually with them.
And joining me is Karen Yost, CEO of Prestera Center. Karen, thank you so much for being here.
It's my pleasure to be here, Secretary Bowling, and we're very happy to be part of the Safe at Home initiative. Wraparound is not new to West Virginia. We actually brought it here as part of Mountain State Family Alliance in 2000, and Prestera was very proud to be part of that. And when we called them intensive care coordinators, which are now wraparound facilitators. So we're very happy to be part of it and very glad to see it being rolled out again on such a broad scale.
Well, we believe it's critical, for our children and families in the state of West Virginia for us to take a different approach in terms of how we deal with, child welfare and the things that we do to ensure that children don't have further trauma as it relates to what happens to them. Many of them have gone through traumatic experiences, and families can be traumatized by all that's, occurring in their lives. Can you talk a little bit about why a trauma-informed approach is so important?
Oh, I can. I'm a big believer in the impact of trauma. Trauma-informed approach really isn't a strategy or it isn't a program. It's a framework, and it's a framework around which services are delivered. And it's a different approach in that we don't throw the same things at families, but we begin to ask different questions. Instead of what's wrong with this child or what's wrong with this family, we ask what's happened to you, what's happened to the child, what's happened to the family. And we look at the context of the family system and what's happening within the family. It's also a way to begin to provide services in a different format. So it's understanding the impact of trauma on children and families and its health, safety, and well-being. But families experience crises, families experience stress, and a lot of times that gets borne out in children, and children are also stressful for families sometimes too if they have a lot of problems. So a trauma-informed approach is understanding that traumatic experiences impact the way children and families function. And it's taking that understanding and using it to develop services and supports that incorporate that so that we don't further traumatize children and families.
Commissioner Exline, spoke briefly about the importance of individualizing the plan for the child and for the family. That's really not been always what we've done in our state.
It is not.
And we're changing that. But how do you change that mindset of everyone around us to understand that, it really is about intervention and that there are things that we can do that sometimes people don't understand. They don't understand the value of these home type of interventions and approaches. Everyone thinks we have to lift them up and take them out of the home for us to be successful. And I know you have very qualified providers working on this.
It's a challenge because a lot of times the things we've done to help children and families have been what systems have allowed us to do. And so we've been victim in some sense to the old model, which is based on a deficit approach. Find the problem, solve the problems. But it's been within a clinical setting versus within the family setting. So our approach a lot of times has been to remove the child put the child somewhere and fix the child and set the child back. It doesn't work. So it's hard to get people to understand that we have to approach children and families differently, that the old methods don't always work. And because if you don't have change within the family, if you take a child out and you put them in a setting and they do very well, and you put them back in the family setting where you haven't had a chance to work with a family, you get what you always got.
Right.
So it's hard to get us out of, that whole philosophy of we remove the child, fix the child, put the child back, even though we all know that doesn't work.
Right.
That's what we've had. So if that's what you've always done, that's what you always want to do.
I think we can change that, and we have. I think we've had great success. I know you're just listening to your providers talk, the folks that work in Prestera, about how they feel about this approach in working with children and families. I know there are a lot of success stories. Can you give us a scenario of what a good story will look like?
I will give you my favorite story, which is an example of why we need to do things differently. We had a young man from one of our rural counties, and he had been involved with law enforcement. He'd been shoplifting and was in the juvenile justice system, headed that way. So we got this child, and we were going to do a plan for him. And of course, our plan was we need to do parenting for the family. We need to put him in family therapy. We need to put him in individual therapy, all the classic clinical services that we had. And we were going to throw everything at this child and family. But because we were able to stop and say, let's consider the family. Let's ask the family what does this mother need? She was a single parent. She worked 2 jobs. She didn't have reliable transportation. But because we were in this wraparound model, we asked her, what would work? What do you think you need? And she said to us, I appreciate all this, but this isn't what I need. My child needs somewhere after school. I work 2 jobs, and I don't have transportation to get him to all of these appointments out in the community. That's what I need. And this child, when we asked him, what do you like? He said, I like basketball. I want to play basketball. So we were able to get this child listening to the mom, who was able to say to us, you all, I appreciate it, but that's not what we really want. We purchased this child a pair of tennis shoes. We had a neighbor who said, well, my child plays ball after school. Well, let him do that. I'll take him home. I'll make sure he eats. And then when the mother came home, he'd gotten to do that. And the child stayed home. And we helped get the mom's car fixed. It needed some repairs. And all in all, we bought a pair of tennis shoes and repaired a car. And the child stayed home and did very, very well. Versus we throw individual therapy and psychiatric services and maybe medication and parenting. None of that was really what this child needed. This mom needed informal supports, not clinical services. And the child stayed home. And that's a perfect example, and it's my favorite story, of how we need to look at things differently. It isn't about the clinical services we throw at children and families.
Perfect example, and a perfect way for us to end this segment, because I think that is factual. That's what we need to be thinking about, of what is it that we can do to keep children and families at home. Tennis shoes and transportation far outweigh the concept of putting children and labeling them with a clinical diagnosis that would follow them for the rest of their life.
And it was a lot cheaper.
Absolutely. Thank you, Karen.
You're very welcome. My pleasure.
Coming up, we'll tell you about a program that helps children get dressed for success when school starts back in August.